Kangaroo care is a therapy involving direct skin-to-skin contact with the mother, father, or caregiver. This therapy is initiated often immediately after birth and involves placing the naked newborn directly on the mother's chest and then placing a blanket or cloth over the exposed back, as long as the baby is vitally stable. In the neonatal patient, initiation of kangaroo care therapy may need to be held off until they are stabilized. While research on kangaroo care does exist, there is a gap in literature regarding frequency of implementation and length of stay in the neonatal intensive care unit. Stabilization of heart rate, oxygen saturation, and temperature have been found as additional benefits to initiation of kangaroo care therapy, aside from maternal bonding. We are proposing that with increased frequency of kangaroo care, vital stability will be achieved sooner, in turn decreasing length of stay in NICU days. Kangaroo care is not currently a mandated therapy in NICU protocols. However, with increased bedside staff and family education, compliance in initiation and maintaining kangaroo care may be achieved more easily. Hesitance often stems at the bedside from concerns of staff access to the patient during periods of therapy, as well as ensuring the integrity of endotracheal tubing and central lines. With our research question being, in the neonatal population, does kangaroo care once during every shift versus kangaroo care every 4 hours have an effect on length of stay in the neonatal intensive care unit? The problem being, is kangaroo care initiated frequently enough to see improved outcomes and decreases in the length of stay in the NICU? The study aims at finding ways to increase positive patient outcomes in the neonatal population by increased direct skin-to-skin contact, which in turn may lead to decreased length of stay in the NICU. The proposed change of our study is increasing frequency of kangaroo care to once every 4 hours from once every 12 hours. Two groups will be utilized, respectively. One, patients receiving kangaroo care once every 12 hours, and then one where the patients receive kangaroo care every 4 hours. Inclusion criteria would be a gestational age between 29 and 36 weeks with admission into the neonatal intensive care unit. Exclusion criteria would include cardiopulmonary instability, in which kangaroo care could potentially jeopardize the safety of the neonatal patient. Minimal resources are needed for study completion, but do include willingness of the families and staff. Hospital educators may additionally be utilized through in-services for nursing staff and families on safe initiation of kangaroo care therapy at the bedside. Informed consent would be provided and requested upon neonates' admission into the neonatal intensive care unit, with informational sheets provided to the families on risks and benefits of initiating the therapy. A tasked intervention within the electronic medical record will be randomly assigned to initiate kangaroo care at either 4-hour intervals or 12-hour intervals during the length of stay. This will also assist in staffing and nursing accountability for the initiation and completion of therapy. Up to 50 participants will be utilized in each group during the study timeframe. Telemetry and pulse oximetry will be utilized at all times in a remote fashion to ensure safety of the neonate, as well as to monitor frequency of bradycardic or hypoxic events. Weekly huddles to get feedback from staff and families on kangaroo care utilization will be implemented. Oishei Children's Hospital of Buffalo is the largest and most advanced NICU in Western New York. It provides 64 inpatient beds and sees around 850 neonatal patients per year, with an average daily census of 50 patients. This would be the most optimal environment, as the largest number of high-risk preterm deliveries occur at Oishei. Time spent for completion of the study would be minimal, pending willingness of patient families. We developed the table shown on the screen to easily record and analyze collected data. Each included patient within the study will be listed separately and anonymously into their respective groupings: Kangaroo Care once per shift, as well as Kangaroo Care once every 4 hours, with the total number of inpatient neonatal intensive care unit days listed.
So some current standards and criteria to initiate kangaroo care. Kangaroo care can be provided to medically stable infants, to infants receiving palliative care, and also within the first 5 days for infants less than 30 weeks gestation. Kangaroo care should be discussed with their physician to make sure that it is medically safe for the infant. So medical staff should intervene during kangaroo care if the infant has increased oxygen requirements or develops any signs of distress or hypothermia. Before kangaroo care is initiated, the provider should ensure that both the baby and the parent are prepared by providing information on kangaroo care, a quiet and calm environment to maintain that privacy and intimacy for both the parent and the baby. There should be time set aside for kangaroo care just to work around medical care time or visitors. And the infant's temperature should be checked and continuously monitored throughout the process of the kangaroo care to ensure that they don't become hypothermic. There are no time constraints when providing kangaroo care, so the mother and baby can both participate in kangaroo care as long as it is medically safe. So the measuring tool that has been used to display the outcomes and benefits of kangaroo care is the progress monitoring model. So this is a model that focuses on the 3 phases of kangaroo care. And these phases are the pre-implementation phase, the implementation phase, and the institutionalization phase. And along with these phases come 6 constructs that help depict the progress. And these are awareness, adopting the concept, mobilization of resources, the evidence of practice, the evidence of routine and integration, and sustainable practice. So this instrument was used and tested in 65 hospitals for research to prove that this is an essential tool when monitoring the progress and outcomes and benefits of kangaroo care. So these standards for classifying, intervening, and the measurement of outcomes of kangaroo care do provide a guideline when implementing the kangaroo care. It can definitely be improved by providing kangaroo care teaching to the parents at the beginning of the 3rd trimester when they are planning their birth experience, instead of providing information on kangaroo care after the birth experience has already taken place. So even though these are current standards of care, they're not always being implemented. There has been countless number of research articles that prove the benefits of kangaroo care in skin-to-skin contact immediately after the birth of a child. And the education of the benefits of kangaroo care needs to begin with the healthcare provider so that they can gain a knowledge and understanding of the benefits, to in turn be able to educate their patients ahead of time and properly implement the kangaroo care to obtain its benefits for both mother and the baby. So, in order to better implement this kangaroo care, teaching needs to be done before the birth experience to be able to implement the kangaroo care and plan it as a part of their birth plan after the infant is born.
The purpose of this article is to illustrate how kangaroo care promotes calm and soothing environments, supports physiologic stability and motor development, minimizes adverse physiologic responses and promotes rest periods, promotes self-regulation, provides care in sync with infant sleep and wake cycle, and evaluates caregiving in times of infant stress. Some of the findings were that kangaroo care provides a calm and soothing environment. There was no increase in apnea or bradycardia with kangaroo care. This qualitative study's purpose was to compare length of stay of kangaroo care versus standard care, or next to a mother in a cot, for premature, low birth weight babies in transitional care settings. For the findings, length of stay in kangaroo care babies was reduced versus standard care babies, 4 versus 5 days. 72 out of 74 respondents loved doing kangaroo care. The kangaroo care group reported The purpose of this journal was to review experiences of kangaroo care mothers at 2 hospitals in Africa. It was found that once educated about kangaroo care, mothers had a positive attitude towards it and began implementing kangaroo care. This was shown to help decrease neonatal mortality rates. This interview
Communicating change. The changes that we have proposed with this study are to benefit not only the patients and their families, but also the hospital and stakeholders associated with the hospital. This could be expressed to the stakeholders by first outlining the benefits to patients, such as stabilized vital signs, increased bonding, decreased hospital stay, and among other benefits. With these, it becomes clear the benefits to the hospital, such as decreasing possibilities of the patients developing hospital-acquired infections, which in turn reduces costs that the hospital would be responsible for. Also, this study would be somewhat of a rarity, giving the hospital more publicity and possibilities for grants for future studies, as well as more business. Integrating into practice. In order to integrate this study into practice, some training will be required. Staff will have to be trained on proper technique and documentation, as well as on education for the families or adult participants involved in the study. Protocols will need to be made and monitored to be sure that they are being followed throughout the study. Families or adult participants will need to be trained on proper technique as well as any adverse effects to look for with the neonates. Monitor process and outcomes. To monitor the process of this kangaroo care study, data will need to be collected properly. We have included a chart on the data to be collected earlier in this presentation. This data should be monitored for completion and accuracy both throughout the study as well as at completion. Individual patient outcomes will be monitored per participant, data being placed within the chart. The final outcomes of the study will be evaluated after all data has been collected, examined, and processed.